The next exercise to help you maintain good, strong stability of your pelvis is called a transverse abdominal contraction, otherwise known as a TA or a lower abdominal contraction. The muscles that we're going to be targeting are the transverse abdominals. They run like a corset from the lumbar spine across to the front of the body on each side. And if you think about it, of course, it's important for keeping you strong and stable in your core, and that's what these lower abdominals are supposed to do. They help with continence, they help with pelvic stability and support, lumbar support, pelvic pain, strengthening after having a baby, anything to give you nice, good, strong stability of your pelvis. It's a really easy exercise to do. What Amy's going to do, she's going to take a nice deep breath in and out just to kind of keep herself nice and relaxed. And she's going to think about tightening from her lower abdominals, keeping her spine neutral, tilting back just a tiny bit just to there, and go ahead and relax. Good. Some people will think about it's like bringing a zipper up, like when you zip your pants up, you're bringing the lower abdominals up and in, and then coming back and relaxing. You don't want to go too far with this exercise. Amy, go ahead and do a really big tilt, and that would be too far. That motion's too much. You're going to miss the lower abdominals with that, and you're going to go up to the rectus abdominals. So instead, you just want to keep it a nice small motion. It's almost like sucking your belly button in to your spine. You're going to feel your spine flatten on the table, and then you're going to relax. You might feel a little bit of a gluteal or a buttock squeeze with this, and that's okay, but go ahead and pull it up and in, hold it in there, and relax. This muscle group is very important because it interdigitates or connects with the pelvic floor. So when you do this lower abdominal contraction, your pelvic floor is raising, it's keeping your organs inside strong and stable. Go ahead and relax. And make sure you breathe when you do these exercises as well. The next good exercise to do would be a progression from the exercise we just did of the transverse abdominals. And this would be starting to include your posterior pelvic floor, your lower back, and your gluteals. She is going to do a transverse abdominal or lower abdominal contraction again. She's going to then squeeze her buttocks together, and she's going to raise up to the ceiling. She's going to hold it up there and breathe, and then she's going to come back down and relax, slow and control on the way up, and slow and control on the way down. So again, she's going to tighten these lower abdominals by bringing her belly button into her spine, squeeze her buttocks, raise up to the top, hold it, and come on back down again. This can help to prevent urinary leaking when you're going from transferring positions. This can help reduce back pain when you're transferring positions, or if you're carrying a load or carrying a baby. This also just allows you to have a nice, strong, stable pelvis, core, and lower back for functional activities. Another good exercise to help maintain good pelvic health and stability and control would be to work on the hips. The hips are good anchors and support for the pelvic floor and the pelvis in general. One good easy exercise to do is called the clamshell. It's called the clamshell in essence because you look like a clam opening. So Amy's laying on her side. Again, she's nice and relaxed. Her hips are bent, her knees are bent, her feet are going to stay together. She's going to take the top leg, she's going to roll it up towards my hand, she's going to hold it for a few seconds, she's going to come down and relax. She's going to repeat that in sets of usually about 10, 20 to 30 per side. When she does this exercise, she's going to feel it back here. Keep going, Amy. She's going to feel it back here in the back part of her hip. Again, good strength and stability to keep that pelvis nice and strong.